midsummer, mid to late summer. These locations all function somewhat independently because they are, most of them are either franchises like a BP station or a Phillips 66, or they're little mom and pop shops that are there to serve their local community. But our goal is to make up this difference. And I've said this before on our tours, we don't exist to replace grocery stores. We exist to complement them. Many times we see our customers will go to the grocery store, but if they don't have a vehicle, that means they're jumping on a bus, they're getting to their closest store. Again, there's only a handful of grocery stores in this coverage area. And then they have to do that all in reverse with as much as they can carry. And a lot of times they're stocking up on non-perishables that can last them several weeks, which means that the fresh fruits and vegetables they might be buying on their grocery trip won't last. And our goal is to be that accessible point for them, and trying to make sure that everyone within has access to that within a half mile of their home. We have taken, per my, this isn't an exact science, but we've gone, I believe, with our presence, if you look at that corridor in Jackson County, that we're about 90% coverage. The holes are a little bit farther in the south where there's fewer stores to pick from, but people are starting to be able to have these access points, and in some cases, multiple access points near their home. And so we have been excited to see that program grow, and we're really hoping to see some explosive growth this year and providing even more access points across the metro. The other program that we run is our redirection program. And so I'll back up just a little bit. The food that we stock in our cooler locations, most of which is purchased by wholesalers in town. So we have two wholesalers primarily that we are getting our fresh fruits and vegetables from. We also have a couple other places, but two primary locations. We do purchase this food because we want to have a guarantee with our customers. When they show up, we want to make sure that they find what they're looking for. These wholesalers will often get rejected pallets of food for any number of reasons. They could have found one bad orange. They could have found one crushed canister of strawberries. They could have a situation where it was delivered, but the delivery driver didn't show up on time, or there was an issue at the grocery store location or distributor location, and it'll get sent back to the wholesaler. In most cases, they just discard that food, whole pallets of food, thousands and thousands of pounds of food. And so we have gone to them and said, you know what, would you give it to us? We can process it because it's not all bad, and we can do something more productive with it. And so we have a redirection program where daily we get food brought in from these wholesalers. We use volunteers to sort through them. We have a 4-tier system where we redirect the food that's given to us. Our highest tier is food that is indistinguishable from grocery store quality food. It is beautiful. It just happened to be near something that wasn't. About 7 to 10% of what we get is able to be added to our inventory for our healthy corner stores to defray our cost and keep it affordable. About 60% of what we get is still perfectly edible. It just might be that ugly food. It might be the wrong size, the wrong color, or we don't sell it as part of our standard list. So about 60% of what we rescue is still edible. We donate that back out to the community, to food pantries all over the metro. We have about 40 pantries that pick up from us every week, and we have another 25 that get food through a partner of ours that we give quite a bit of food to. So all in all, we have about 60 locations across the metro, and that's Kansas and Missouri, that are getting edible food. And our team is fairly efficient. We get food in by 7:30. It is picked up by these partners by 11:30 that morning, so 4 hours later, and it is in people's homes by 5 o'clock that night. And so food that was otherwise going to go straight to the landfill is making that big a difference. So if you're doing the math, 65 to 70% of what we rescue is still helping people. About the lower 30%, about 15% of what we get is not quite trash. It's not something we would want to eat, but we've found farm partners. So pig farms, chicken farms, cows, horses, goats, and they will come and pick up this food that's not quite moldy, not quite rotten, but it's a little leaky, a little juicy, but it goes out. And about 15% of what we're able to rescue still can do some good with animals. And then the last 20% is compost. And KC Can Composting Company works out of our facility. So we have a just partner right here that is able to take all of this compost that we're generating. And that goes back to Missouri Organics, goes back out to farms and stays in the food system. And so we call it a zero waste program. Last year, we rescued just over 1 million pounds of food. This year, we're going to do about 1.25 million. And this year is a kind of a re-strategizing, restructuring year, because next year we want to shoot for the 3 million range and up. I will tell you, 1 million pounds is, I love this example our team tells to our groups that come through. 1 million pounds of food would fill Arrowhead Stadium 6 feet deep with food. So if that's a more helpful visual of how much food that we're talking about that would otherwise have gone to the landfill, that's what we're talking about. The truth is 1 million pounds is a huge milestone for us, but it is the tip of the iceberg. There is an incredible amount of food waste in the city. And so we are looking to find ways to take more and more, realizing that a fair amount of that could be increased compost. But we are still finding that food that is still good and still edible. So all that to say, those are our two major programs, and they feed into one another. Like I said, about 7 to 10% of what we rescue defrays our cost. And our hope is that we can get to rescuing enough good food to really keep our costs down. We talk a lot about affordability, and access and location is a part of that affordability that we're able to provide. Being nearby, being close to someone and near their home is a way that they can access this wonderful resource. What we found is that we have to expand that definition. Access can't just be where you are, because if you can't afford the food, then it doesn't matter where it is. And so, and that's a little bit of what I want to get into for the topic of this conversation today, which I realize that was a big introduction, is our Food is Medicine initiatives. And so we have a couple of kind of side projects that we're working on, some of which that are becoming more standard for our operations. And there's two ways that we're helping provide food to people. One is through providing coolers and delivering food actually to some healthcare providers. So we have a refrigerator-sized cooler at Children's Mercy in their CFCC clinic. And once a week, we stock that to the brim. They pay for the food wholesale from us, and then they distribute it to patients who have just visited their location, had a consultation with their physician or their nutritionist, and are able to leave their visit with an armful of groceries that they take home. We see about 60 to 70, that helps 60 to 70 families a week through that initiative. Those patients do not pay for that food. It's a wholesale purchase from us by Children's Mercy. We also have a similar setup with Veterans Community Project down south. We're also in what used to be Dedicated Senior Medical Center, which is now Centerwell Senior Medical Center. And we're about to expand that, hopefully on the Kansas side. Talking to actually Sharela and Mariana and some others at KUMC to get some of this produce quickly available to patients. The other side of this is our produce prescriptions. And so we've piloted a couple programs now that are running fairly smoothly right now, which is a voucher program. And so there was a grant given, we're working with St. Luke's right now to enroll. We're actually in our second year of this program. Patients that would go to a visit at St. Luke's and would be screened for any number of needs they might have. It's a social service screening. It can include food insecurity. And if they are located in a zip code where we have a participating Kanbe's location for this voucher program, they can get enrolled in a 6-month program where they get $10 vouchers a week to spend at a Kanbe's location for fresh fruits and vegetables. So we've had about almost 90 patients go through this program. We have about 20 or so that are currently enrolled. We also opened up the Independence office as well. So we were able to expand and get more patients in there. 7 of our stores participate in this voucher program, and we hope to expand that probably by another dozen or so by the end of the year. But this is a way for patients to have an autonomous, dignified way to get the food, fresh food that they want. Again, trying to overcome this issue of access related to affordability. We just started our pilot in November with Children's Mercy as well. So Children's Mercy has and theirs is a research grant. And so the St. Luke's is a 6-month enrollment. Children's Mercy is a 3-month enrollment. We give them a little bit more. It's a $20 vouchers for families, whatever. But they are able to go and redeem those to get fresh produce for their family on a weekly basis. And $20 will get you a fair amount of food. Again, we're trying to keep our costs as low and accessible as possible. But this voucher program really has expanded. We're in 4 public schools. And so I've been working with a coalition to get those funded as well. So we're piloting vouchers to get to specifically high schoolers. We have 1 elementary school. If a child comes and talks about food insecurity, they can often access the food pantry on site, but this is a way for them to take these vouchers home and be able to utilize those vouchers to support their family's health goals. And I'm actually talking with KUMC right now. I'm talking with Ellie Jobst over in the nutrition department about getting vouchers available to her department as well. So these vouchers are becoming more and more accessible and more widespread. Again, trying to help our mission of making sure food is accessible. We also are about to get into the Boys and Girls Club. So we're going to even getting outside of the healthcare system. We're going to install 2 coolers in 2 of the Boys and Girls Club locations in Jackson County, I think next week. And they'll be doing something similar where they wholesale purchase from us and then distribute to their population. So that's a lot. How about I pause here and just see if there's any questions, and then I'll let Max fill in any details or cast some vision for where we might be going next. But any questions that I can answer for you just about our programs and how they work?
I just think this is such amazing work. So thank you.
Thank you. Thank you. It's a lot of work. We're doing it. The January, February was rough. It was there was a lot of snow, but we've made it. Hi, Lisa. I see your hand up. Yes. Oh, I can't hear you, Lisa. Is that just me?
No, I wasn't able to hear her either.
I think I saw another hand go up, but maybe while Lisa's.
There we go. Dola Williams.
Yes. Hello and good morning, everyone. So I just want to try to understand the process. So if I'm an organization and I want to provide the produce prescriptions, I would purchase the fruit from you, and then I would have vouchers to give the persons that I'm serving. Is that how that?
It could go either way. If you wanted the food on site, that would be the discussion of we could get a cooler, come up with an inventory list, and we would stock it based on whatever budget that the organization has. So we have a few tiers. For example, at the Centerwell site, they do about $50 a week. Children's Mercy does about $500 a week. And so we're kind of anywhere we're in between, but we're able to provide it at a lower cost than a grocery store purchase. And it's a lower cost than even our Kanbe's sales at the store location because of the way that it's bulk purchased through us. The vouchers is different and actually even an easier process because as long as they're funded, typically just tell us what you have, we'll print out those vouchers, you distribute them, and we'll tell you as they're redeemed at our location. So vouchers is actually a very easy turnover. It's basically a coupon or a gift card, a gift receipt.
Okay, you answered my other question. I see other hands are up, but just right quick. So if I distributed vouchers, they would come to your location to
Right.
redeem.
Yep. And the
Okay,
nice thing
great.
about the vouchers is they are only good for Kanbe's produce.
Okay.
which is better than just giving a generic gift card that can be used for
Right.
anything at a store location.
Okay. Thank you.
Yeah. Hi, Nicole. I see your hand up.
Yes, hi, James. I had just a further question about that. If we were interested in the vouchers,
Mhm.
do we just reach out to you? And are there a number of locations that people could go to redeem the? I know you just said candies, but is it just one location or are there several locations throughout the city?
There's 7 locations right now. Here's what on our website. If you go to cambysmarkets.org and look at our Healthy Corner stores, there you'll see the specific locations that are designated as voucher redemption locations. I can show you a little. This might be even a little easier. Let me throw this in the chat here if you want to see. If you click on that, that's a Google map. It'll show you specifically the red stars are the participating voucher locations. And we tried to spread them out across a number of zip codes. Again, that is how our healthcare partners decide which patients are eligible. They only will accept patients that are in or very close to the zip codes where we have a participating location. So that's the discussion. I just had a meeting with them last week about what new zip codes will we open by onboarding new stores to accept vouchers. The nice thing is that the store still benefits from the voucher. We still share that as a purchase with them. So they have a lot of incentive and they're very familiar with coupons and how coupons work. So it's not been a hard sell to onboard stores to accept them.
Thank you. This is a great program. Thank you.
Good. Well, thank you. I just saw a chat. Lisa, you said you mentioned some descriptions, but can you speak further about how you measure your reach, number of sites, number of people served, number of pallets or pounds, et cetera? And then also, do you receive further assistance from regional grants, philanthropy, et cetera? So about our scope, we're located at 31st and Terrace, kind of northwest kind of metro area. Really, we're focusing on the urban core here. And even as we go into kind of Wyandotte County, we're talking about Independence. We are talking about a reasonable driving distance from where we are. We have talked to organizations that would love for us to go out to the far reaches of rural Kansas. And right now we're focusing on the metro area. But by our count, we're somewhere between reaching, again, with this half-mile objective, between 106 and 130,000 people right now. And that hopefully will expand and grow as we get into the Northland and look into Wyandotte County. I'll defer to Max to talk about some of the grants and philanthropy stuff. So so Lisa, the red stars are the voucher locations and the black ones are other participating locations.
And yes, to piggyback on what Jimmy was saying, we receive funding from basically any source we can. We have several like regional partnership grants. We are primarily funded by some of the like larger family foundations here in town, and then we do constantly work to grow our kind of individual giving. So just ordinary folks like all of us that can give $5, $10, $20 a month go a long way in supporting our work.
Emily.
Hey, Emily Roundtree. I'm the Climate Adaptation Partnership Specialist for NOAA. I have a very similar offshoot question of what we just talked about. I am interested in your fundraising structure for a more community-wide, like how can you schools and churches and all of that kind of get support for y'all?
Yeah, I mean, really, we need funding from any and all different places, and especially given the current climate, we had some government funding that we were kind of counting on, and so we're trying to shift and diversify that as much as possible. So I mean, if with schools and churches, a lot of times it's great to have those groups come in and volunteer and get to see the space, get to know us a little bit. And then, like I said, anything from like larger grants and gifts to individual monthly giving. all make a huge difference in making sure that because we're delivering to our stores 5 days a week, and so we are hitting 75 locations 5 days a week, and so it can be an operationally heavy kind of organization, but making sure that quality is there, I think, is crucial to building trust and eventually making the changes we'd like to see.
Great, thank you.
Yeah.
Hi, Rebecca.
Hi, thanks for this, for sharing this with us. So as many people have said, this is a really great program. Sounds like you're doing really amazing things. And I'm just curious if you've been approached or are sharing this widely in terms of scalability with other cities. I'm sure other cities would love to hear about how you've got your zero waste recovery program. Is just amazing.
Well, Rebecca, you're so very kind and kind of taking the vision right from us. This is exactly what we're hoping to do, is to build something that is replicable and scalable in other cities. So we work with kind of a national network of kind of convenience store model programs, and we have been sharing again the waste diversion side of it and the profit sharing side of it. To look at like we were just in actually DC about a week ago, working with DC Central Kitchen and their Healthy Corners program. We work on the ZWFC is like a national group of organizations working in the kind of food access space. And our hope is that within the next couple of years, we will really be able to start actually taking this model to other cities. But I think Kansas City can fix it first.
I didn't put my hand up, but since there's a gap here, I was wondering if Max and Jimmy, you could talk a little bit about other community forms of outreach to get the word out about your organization. So for example, I've heard from a bird that there's something called an ugly dinner. Can you talk a little bit about how you can also reach, just more visibility about this amazing work? Thanks.
Oh man, you're again so sweet and kind. Because we are still a new organization, all things considered. So getting the word out, I think, is very, very important. And I hope that many of you today can help us kind of share our message or let people know that we're out here, we exist, and that we're trying to affect change. A way that is a lot of fun to come and do that is we have an ugly dinner series. So our next one is coming up at Novel. So we partner with some wonderful restaurants around the city, and we'll work with kind of the chefs there to create kind of this beautiful meal using ugly food. So it's the food that isn't even quite good enough to go into our stores. We will make a kind of a 4 or 5 course dinner working with the chef team there as a fundraiser, but also as a way. They're typically 20 to 40 seat kind of events. So they're a bit more intimate. So it gives us all a chance to share our work and answer questions and get to know the people that are at the space rather than like a big gala, which it was just not my style.
And I'll piggyback on the other side of your question there, which is about getting the word out in the communities. So we have a community engagement team. And in addition to onboarding new store locations and helping us with our expansion goals, they are also inviting the community to participate with us by forging relationships with neighborhood associations, with local nonprofits, with schools, faith leaders, local political leaders, schools, trying to figure out how to invite people into this decision-making process. We want the community to feel and legitimately be involved in the decisions that we make. The phrase that I tend to use is we're not a parachute drop organization. We don't want to be on one side of the town telling another side of the town what they want or what they need. We want to know so our drivers are trained. This will give you an example. Our drivers are trained as they go out to all these stores every day, 5 days a week, to curate the items available in that cooler to the neighborhood's desires. And so there's some neighborhoods that really like a certain kind of fruit and will overstock that. Or just like, this might shock you, but broccoli and carrots, I cannot sell them. Nobody wants broccoli and carrots. And so I've really removed those from kind of high visibility on our list. And I've really ramped up some other things. We sell mangoes, which is not necessarily something very common, but year round, you can go to a Kanbe's cooler and get mangoes, and people tend to like those. If anybody can help me get affordable avocados, I will listen. I will take your number, because avocados are so expensive, but people really love them, and they're a great source of nutrition. And so we're trying to help, and when we get food rescue in, that's where sometimes we can offer items that are not on that kind of standard 15 or 16 list. That's where we can get some of the like Anaheim peppers, Serrano peppers, poblanos, things that we wouldn't necessarily purchase, but we'll rescue them. And there's some specific stores that request those anytime we get those in. And that's a way we help that community build their own inventory lists so they can get the food that they want. But our community engagement team is out in the community 2 to 4 times a month at major events, neighborhood sponsored events, or even at monthly neighborhood association meetings. We're at Washington Wheatley, Dunbar, heart of the city, 23rd Street PAC. We're there almost every month, making sure that we're understanding what is going on in the local neighborhood and inviting them in. We also have a community advisory board made up of neighborhood leaders, people that are in Jackson County living and working either as part of a neighborhood association, nonprofit, et cetera. And we meet with them on about a quarterly basis and get their feedback and insight and input into what we're doing to expand our efforts as well. So our hope is that this is as much a partnership as we can possibly make it.
Incredible. How many people, well, I want to know how many are in your staff, first of all, because that sounds like a ton, but I raised my hand because, and maybe this is not allowed, but I know a lot of us on this call really care about food as medicine and really care about growing our own food and keeping food local. If you need peppers, I'm guessing this summer, a lot of us, I'm just going to speak for myself. I may have peppers that I grow and I would love to donate food. Is that something that citizens are allowed to contribute if there's a list? And if so, can you send us a list or put it in the chat? Like, what are the, because I'm always interested culturally in terms of what groups like what food and how can we support them? Thanks.
That sounds great. I would love to get you a list, and I'd be more than happy to have locally grown food into our system. So one of our team members, Sydney Shire, is our redirection coordinator, and she is the one that manages all of our intake of food across all places. So what I'll ask her to do is put together how the donation process works if you have food that you'd like to donate to our cause, and the schedule for that and what we're looking for. So as you're preparing your spring, summer gardens, we'll let you know what we're interested in, especially some of those nice to haves that sometimes we don't always get or that are too expensive. I'll take jalapenos every day of the week. I can always get rid of jalapenos. And so things like that could be a lot of fun, but I'll have that as a follow-up to this meeting. All right, Dola Williams, I see your hand up again.
I'm sorry, I was on mute. I was just talking away.
Oh, that's good.
Okay, so when you mentioned broccoli and carrots, it's something items that people weren't gravitating to. One of the things that had come to mind was during COVID when the food distribution was so high. We're in areas where I was associated with the food distribution. It also wasted because people didn't know what to do with it.
Mhm.
You know, they didn't know how to cook it. They didn't know what it was and all those things. And especially if I'm gravitating to this conversation because you talk about food as prescription. So I'm wondering, do you have a program that talks about how to cook it, especially if we're getting it and it's almost, it's still good, but
Mhm.
for people who don't know how to use it when it's,
Yep.
Fully ripe, my God, what are they going to do with it then? So
Sure.
just
Well, and
curious, do you have any education pieces to that?
excellent question. And the truth is, we we do love the idea of helping people figure out what to do. I'll tell you, our St. Luke's partners, so our vouchers through our St. Luke's program, part of the service they offer all of the patients enrolled in that program is not only some nutrition counseling, but a weekly infusion of recipes that you can
Awesome.
use. We talk about that often and about what kind of services that we are prepared and kind of qualified to recommend. I'll tell you, I was just talking to Andres, our community engagement director, yesterday, and I was saying one of my visions would be to have the recipes come from the local neighborhood. And if there was a way that we could invite people that have these legendary recipes from, from yesteryear, family recipes that have passed down, could we put that in a store location and just say, this is Miss Jane's, famous casserole, and here's the ingredients you need for it. I just think that would be a really fun, special way for a neighborhood to support one another, stuff like that. But right now, we don't have a formal presentation of education options or recipe options that we provide in our stores. But I think we have some partners that are passionate about that. I do know some of our donation partners in particular. So if they receive that tier 2 food at food pantries or whatever, they also are providing some coaching and resources like that. But right now in our Healthy Corner stores, we don't offer that, but it's not because it's not a good idea. I think it's more the time.
That's cool. Thank you. Thank you for your
Sure.
response. Mhm.
I also noticed in the chat a question about eggs. We are going to be piloting some eggs here actually very soon, probably before the end of April, just to see. Eggs are so expensive right now, and through our friends at KC Food Hub, we might have a beat. We have a beat on some really affordable, locally sourced eggs. And I think eggs are just a great complement to what we already do. So we're going to be experimenting with that. And then potentially by the summer, we could be offering eggs as a supplement to our produce. So stay tuned for that. Oh, Emily, yes. Send eggs our way. We'll take them. We can find a good home for them. Mary says, do you work with Meals on Wheels, or do you have other efforts for getting fresh produce to homebound folks? During COVID, we had a program called the Home Delivery Meals, and that's exactly what we were doing. Thousands of meals that we were processing. It was a partnership with the Mid-America Regional Council. We have discontinued that program from our side of things to focus on access and really making sure that the provision of this access, we do what we do really well. I'll tell you, we talk about scope creep daily around here because there is so many ways that food could benefit people. And we get requests for partnerships quite often to diversify some of the efforts that we're trying to accomplish around here. There are so many great ideas. We also can't do them all and continue to do this access project that we're committed to for this season. That being said, I know Max well enough to know as an entrepreneur, we're always going to be trying things and experimenting with new things. And if there's a need, especially when it comes to food, what can we do to address it? Really, for me, it's not, is it a good idea, but is it the time for us to be involved in that idea? And I think what that question would showcase is the need for partnership and the fact that Kanbe's plays a role in the food justice system in Kansas City and is crucially important for us to partner with other organizations. And just to show you an example of that, in our warehouse, we have 3 other food justice systems that work out of our location. KC Can Compost Company, which I mentioned already, the Kansas City Food Hub, Urban Produce Push, all work out of this space. And we are regularly exchanging ideas, food, news, collaborating on grant requests, collaborating on seminars out and presentations all over the city. There's a lot of communication around food that we are involved in. And they happen to be involved in areas that we aren't set up for. And through that partnership, we're able to accomplish more together than we are apart. And so we only hope to see that grow as well.
No one talks about how hard it gets.
I'm sorry, say that one more time.
That was an error.
Okay.
Hope has a question or hand raised. Yeah.
There you go. Hi, Hope.
Hey, I'm back. My other meeting ended shortly, so that was great.
Yeah.
this is a scope creep question, and so I think it's
Mhm.
actually perfect timing for that based on your statements, because I could not agree more that there's an opportunity cost for everything you choose to do, right? Like you're choosing not to do something else if you're doing whatever. And so I appreciate your thoughtful approach to that. My question is around kind of some of the work that we're doing around cancer screening and some of that other activity, and thinking about you're reaching a lot of the individuals that we're hoping to connect to healthcare. So I don't know if there's opportunities for us, not you, but happy to have you too at the table, but for us to even think about, here are some markets that have decided that they care enough about the community that they want to make sure they have access to fresh fruits and vegetables. Is that something we should start thinking about, like just reaching out? We don't also want to cause them problems. We're just so happy they're working with you that we don't want to do anything that makes them go like, oh, now everybody's coming to me. You know what I mean? So
Well,
do you have advice for us to think about how to do such great inreach that, you know, that such outreach that you're doing right now? And are there opportunities for connections?
Yeah, and I don't know, Jimmy, I can take this one, because this is absolutely something we talk about a lot, and seeing like where and how we want to leverage these partnerships. And so it sounds like what you're saying, like the connection to some of these store owners is really valuable, and that is something that we try and act as a bridge often enough, where we say, okay, hey, this isn't something that we do, but we can leverage the relationships that we already have. So for example, right now, we are actually working with like the KCPS and the bond vote that's coming up. So it's nonpartisan that we're putting out there, but we are like just helping distribute information about getting out to vote. And so using our stores as access points and distribution for not just food, but a way to connect people to different forms of information. And those are things that we've done in different ways in the past. And so we've worked with the health department for some of the educational programming. So there are ways that I think that we could do some of this. Like there was one we worked with a few of our locations over like a 6-week period a couple of years ago to do some health screening on site at the location. And usually we ask that there's kind of like a give there to the stores. So like we wanted to make sure that the stores were paid since they were asked to do a little bit more, and that community members who were coming in to participate had some kind of like kind of gift or thing that they could walk away with. But we are happy to like have further those conversations and see where they go.
I would really welcome further conversations. We do these breast cancer health equity, they're called friend to friend, party with a purpose sort of thing that we do it at churches in Kansas City, Missouri, really focused in areas where it's low insurance, higher Black women population, because Black women are more likely to die of breast cancer than anybody else. And so we really want to be able to connect them to connect women to resources. We also so there's, and then we do other cancer screenings periodically in the Kansas City metro area. And so I just think there might be some opportunities to connect related to that, to make sure we're
Yeah.
reaching the individuals in those communities.
But yeah, I would love to do like a follow-up conversation on that.
Sounds
Because again,
good.
yeah, we are always wanting to see, what is our role? And sometimes our role is to connect and to see how we can help facilitate something like that happening. And sometimes it's to play defense for these stores, to say like, hey, everybody wants to come to you, and so if this is inappropriate or if they're not interested, for us to say, hey, look, they're not interested, and we can figure out another way around.
Completely understand. I work with Alliance of Hospitals across the state and other healthcare providers, and really don't try to be a door, but definitely don't also know that
Yeah.
they don't have the opportunity to
Mhm.
they can get inundated once they say yes once.
Yeah, and that's where, but we're looking for reasons to continue to talk to our stores. So we're always wanting to find ways to better that relationship. I mean, we did another one, in the election, the 2 election cycles ago, where a lot of people were having to vote remote and get votes notarized. And I think with 6 of our locations, we helped get over 10,000 votes notarized. So we're happy to try and connect where we see benefit.
So I'm just, this is Dola again. So I work with Hope. I work with Angela. I'm a resident of Wyandotte. I just called Gary Wilson. You all have already talked to him. So if you're going to do something in Wyandotte, it would be great to get all of us together so we're not tripping over. I got a whole list over here so that we're not tripping over each other and we, are collaborative
I love that.
ourselves.
Yeah.
'Cause,
Yeah.
yeah, because,
1000%.
okay. All right.
Yeah, can we connect you? So we just recently hired a community engagement director. So somebody to kind of, that department was kind of living under Jimmy, and you can probably imagine he's got a lot on his plate. And so we brought in a new director, kind of run the community engagement piece. And he spent the first kind of month just getting to know us and our systems and leaning into like the Missouri operations. But that has been kind of the intention, is before we would do anything in Kansas that we have to do exactly the work you just mentioned. So I would love to connect him with you.
Sure. I'll put my email in the chat. And I wear a couple of hats. So I'm with KU Office of Community Engagement, and I have a breast cancer organization, and then I work across a couple of but Wyandotte is the heart of the matter for me. So that'd be great. Thanks.
Yes, I would love to connect you and Andres, and we're spending this whole afternoon is just strategizing for the rest of his year. So really looking at like where and how we need to be prioritizing his time.
Awesome.
I won't lie, I'm losing track of how many people on this call I want to follow up with after this.
Yeah.
So I threw my email into the chat. Please send me, it's james@cambysmarkets.org. Please send me any follow-up, interns, eggs, gardens, chickens, all that kind of stuff. Please follow up. I can point you to the right team member. I think someone had asked a second ago about the size of our team. We have just over 20 staff. Are we at 24, 25 staff if you include our driving team? And that is our program staff, driving staff, our external affairs and fundraising team. So we're small but mighty, and we're getting a lot done. We will probably double our fleet this year as we expand into Wyandotte. So we have 4 trucks that go out every day. We're probably by the end of the year we'll have 8 or 9 that are going out. So the operation is growing.
Well, this was a fantastic gathering of the minds and hearts and energies, as I think Lisa put on the chat. So, Alan, what do you think? Should we keep it going, or are there any more questions?
Well, yeah, if there's any more questions, please jump in. I apologize. I'm getting a ride to the airport, but I've been listening. This is really great to hear all this great work. As a researcher, I'm just thinking about how this is a great example of kind of addressing a social determinants of health need that in healthcare historically we haven't paid a lot of attention to. So it's just really inspiring to hear about, and the connections. Hopefully lots more connections will evolve out of this.
Yeah, so thank you. We would love to continue some of these conversations, especially as we are stepping more into the food as medicine space and things like that. We have a lot to learn in this space, and we like to focus and be very good at what we do. And we're getting better at the distribution part. But I think that there's so much knowledge on this call that we really hope to be able to continue these conversations.
That's great. We have a newsletter that we're so fortunate to have Sharilla organize. If you could be part of the network and send us stuff that we can then share out, we can help with that. But, again, sometimes we're really siloed. So this is one way to begin those conversations.
Yeah, we could definitely get you some of that, and we'd love to.
Right. Well, thanks to Max and Jimmy for coming, and thanks to all of you for your amazing engagement. And as we said, we'll all be in touch. And Alan, safe travels. And we will be in touch next month. And you guys are always welcome to come to our meetings too, if you want to just join. This is what we're doing. So yeah,
Fantastic.
anytime. Yes.
Thank you so much for the opportunity. We appreciate it.
Okay, bye
Awesome. Thank you
everyone.
all.
All right.
Bye. Thanks.
Bye.
Thank you. Thank you.